In 2007, an estimated 50 million Americans were uninsured, with the country ranking 27th in the world for healthcare. As of 2023, there were still an estimated 26 million people left uninsured, and the United States dropped even further, ranking an abysmal 70th in the world for healthcare, despite the passing of the ACA in 2010. Why does our system continue to fail the American people no matter how much money we spend? Join us today as we take a look at the cost of health insurance with the 2007 documentary Sicko. You're listening to Real Stories, Real Problems with Rachael and Roxanne. Right, and today we actually have a special guest star. My very good friend Amanda is going to talk to us about the documentary Sicko because Roxanne is in traffic court and cannot join us today. How, how are you doing today, Amanda?
Oh, I'm not in traffic court, so that's kind of the most important thing.
Yes. Oh my goodness. So this has been a heck of a documentary to watch this week. It was much longer than I remember it being. It felt like almost 2.5 hours. Um, but it, feel like still applies so much in 2025, even though it was made in 2007.
Yeah, that was kind of one of the things where I most wanted like an update. I wanted a post Obamacare, post pandemic update to see what has changed and what hasn't.
Well, I did some
And
research and
man.
I have some of those numbers for you.
Oh, great.
But first, let's talk about what was going on in 2007. So, in 2007, Nancy Pelosi became the first female Speaker of the United States House of Representatives. Apple CEO Steve Jobs introduced the original iPhone at the Macworld keynote in San Francisco. The Intergovernmental Panel on Climate Change published its fourth assessment report, concluding that the global climate change is very likely to have a predominantly human cause. That was the year of the Virginia Tech massacre, where a 23-year-old student fatally shot 32 people and injured 17 others before committing suicide as police arrived on the scene. That was the year WikiLeaks became or WikiLeaks actually leaked the standard U.S. Army protocol at Guantanamo Bay. That was the year that Madeleine McCann disappeared, the British 3-year-old who was kidnapped, and the Daily Telegraph described that as the most heavily reported missing persons case in modern history. And that was also the year that Mauritania was the last country to criminalize slavery, even though it had officially been abolished in 1981. So 2007 was the year that slavery became illegal in every country in the world.
2007, that's way too late for that to be.
Way too late, but also not exactly accurate because like the US still allows slavery if they're prisoners. Like
Yeah.
it's a whole thing. But so that's what was going on in 2007. That's the world that we were living in at that moment. And that was the year that I moved to New York and I really, just decided I was going to try to make it in the Big Apple. And like there was a bunch of stuff going on for me personally too. But looking back on all of that, it is nuts to me that the first iPhone was released before we had the ACA. That all of this stuff was going on in a time when 50 million Americans were uninsured, and all of the stuff that happened in this documentary had been happening, seeing people do surgery on themselves or choose which finger to reattach after a dismemberment because they couldn't afford it. So to know that, like, there was all of this really cool stuff going on, but at the same time, we are so in the dark, like health insurance wise.
Yeah, it's wild. I mean, I've been I recently did a binge rewatch, I should say, of Friends, and there's a whole episode where like the premise of it is that Rachel doesn't have health insurance and Monica does, and when Rachel gets injured, she gives Monica's name at the hospital, and then of course they meet these doctors and they're so cute. One of them's played by George Clooney, and I'm just I was thinking about, I mean, we have an entire television show dedicated to the idea of this man couldn't afford his cancer treatment, so he started cooking and selling meth. And it, like, how just ingrained it is in our culture that healthcare can and could and probably will bankrupt you. It's
Yeah,
wild. Like, it's just, it's bananas when you, it's that thing you don't think about until you realize how in so many other countries it's just such a given of, why would this cost me money? I need it.
yeah.
It's for my
And
health.
what I will say is Michael Moore does a different type of documentary than other people. Like in other episodes, we have talked about other documentaries, and it's observational. Like they're talking to people going through these situations, but it at a distance. Whereas Michael Moore really gets involved, and he is less about experts and statistics and more about the personal story. So you really get to dig in and learn about these people and the impact that this is having on them. There were so many people featured in this documentary. I don't even know that I recorded them all. I have a list of notable moments and notable people, and there were dozens and dozens of people who were all part of this documentary. And we saw, like I said, we saw one guy. It opens with a guy named Adam sewing up his a wound in his own leg, and it talks about
Yeah.
this is going on under the audio explaining that he was one of 50 million Americans who had no health insurance, and so he was doing his own surgery at home.
Yeah, it's just it's horrifying, and like, I mean, I'm thinking back to, I'm just thinking of my own experiences, not even so much with healthcare, but with being in other countries. Like, I remember being in London as an undergraduate and someone saying that England was a welfare state, and I had this weird moment of almost like, how could you say such a terrible thing about your own country? But I realized, because, in the US, the idea of, oh, a welfare state, that's almost a slur. But in England, at least, it was, well, yes, this is a state that cares for the welfare of its people. And shouldn't we want that? And it's just such a, yeah, I mean, I love the way that Michael Moore does get, so it's so human. Because I think it's, especially with these big issues. I mean, you see 50 million Americans are uninsured. Like, where do you even start with that? Whereas saying, like, here are some individual people, it makes it so much easier to understand. You know what I mean? And I think it's also one of those things where there's so many people who might, vote against certain healthcare reform, but if you actually ask them person to person, hey, do you think, Bob next door should have to skip out on this surgery that he needs because he can't afford it? I'm pretty sure they'd all say, no, that's horrible. Because they know Bob and they love Bob. And it's, oh God. I feel like I'm just going to spend so much time tonight just being like, God, it's terrible. God, what a terrible situation.
Well, and he does get into at one point in the documentary talking about how different it is in other countries and other cultures and how they approach health and wellness in a very different way. But it's not just health and wellness. Like I know that even like in America where we are big on law enforcement has the right to do whatever they want. They can detain you and arrest you for pretty much whatever. And like it's a very, very police state feel to the United States and has been for a long time. And about 10 years ago, my husband and my daughter and my mother-in-law and I were going to Canada. We were going to Montreal for a vacation. And the whole time up, my husband is making jokes about, I'm gonna say this at the border and they're gonna arrest me. And I'm like, no, you're very funny, but shut up. Do not get us
Yeah.
arrested at the border.
Yeah. Yeah.
And then we pulled up and they said, do you have any weapons? And I said, oh shit. I have pepper spray on my keychain and that's illegal here. And they had me pull over and I had to go inside and they were so nice. They were like, here, do you want to mail this back to yourself? You could throw it away here. We have, and they were so kind. I brought a weapon into their country that is illegal in their country. And they're like, no, don't worry about it. Like, it's cool. We understand.
Yeah,
That would
I mean, maybe they were just like, if that they've got an American who says, "Yeah, I have a weapon." They're like, "Oh dear God, she's gonna have an AK-47." And then when you say, "Oh, I have pepper spray," they're like, "Oh, that's nothing," you know?
But yeah, so it's just a very different approach from in almost every facet of life when you go to another country and seeing how they talk to like Larry and Donna Smith, the couple that had to move in with their daughter and they had to sleep in bunk beds in her spare room because he had
Oh
three heart
God, yeah,
attacks in the course of like 18 months and they couldn't afford to live anymore. And
yeah,
they talked about they'd had to declare bankruptcy, and then they talked to Frank Cardeal, the 80-year-old guy who was working as a janitor to pay for meds that weren't covered by Medicare at that time, and like he's talking to these people, and later, and in the documentary, like he gathers a group of these people, including 9/11 responders who were, not getting the treatment that they needed. They couldn't afford the medications that they had been prescribed. And he takes them all to Cuba. And
yeah.
this was this was peak Michael Moore, where he gets on a boat with a bullhorn and is yelling at the American embassy from the ocean. How do we get into Guantanamo Bay? I want people to have medical treatment at Guantanamo Bay. And you're just like, oh my God, what kind of nonsense? And then they black out the screen and they're like, we can't show you how we got into Cuba. And I'm thinking clearly they went to another country and then left from there because that's how you get into Cuba. You can't get there from the United States. And he takes them in, and the doctors there, they speak English and they treat people and they get their MRIs. And one woman had a inhaler that cost her $120 per prescription in the United States, and it was literally a nickel. It was 5 cents in Cuba.
Yeah, yeah. That really that jumped out to me too. It's well, again, it's like you said, it's there's such a different just approach or thought. Like I remember I was in Ireland not too long ago, and I just remember thinking like the attitude there seemed to be very like, well, if it's going to be good for people and it's not hurting me, why wouldn't I want that? Whereas I feel like in the US, it's if that isn't directly helping me, why would I want that to exist? Or, or I just, there's, I'm trying to think if there's really any other industry, for want of a better word, in our culture that has the kind of weird restrictions that we have in healthcare. Because, I mean, the idea of, say, needing a doctor's permission to get certain medications, that makes sense. It makes sense to say, all right, this is medication. We need a medical professional to say what you need, how much of it, in, how often you need to take it, whatever. That makes sense. But then we have some random third party who doesn't know you coming in and saying this is what you do and don't need it. To me, I don't think there's any other industry where things operate quite like that. Again, just the idea of I can agree with my doctor that, hey, this is the problem I'm having. This is a good way to treat it. And then again, some random third party can come in and say no.
Yeah, the more that I dig into America as a culture. And this is the seventh episode we're making of this podcast. And we've done, I've worked in the health insurance industry and other insurance industries for years and years and years. And kind of just my life experience tells me that America as a culture is built on a foundation of distrust. You do not ever
Yeah.
give an inch to anybody because what if they're scamming you? What if they're trying to steal from you? What if they're taking something from you that you might rightfully deserve? We have built a society around not trusting one another. And because of that, the insurance company can come in and say, "Well, your doctor may be scamming you. You want us to be the intermediary to make sure that they're not putting you on medication you don't need so that they make extra money." And then like it becomes this circle of everybody everywhere is all trying to screw everybody and you're the only person that you can trust. And it just makes living in this country an absolute hellscape.
It really does. And again, it's like you said, it's that fundamental mistrust. I think we are so much more afraid of what if we have this and somebody takes advantage of it? We're so much more afraid of that than what if we don't have this and somebody suffers? And people are suffering, and people are literally dying because they cannot access health care. And
Yeah, a
is that
lot of
really so
people.
much
Like,
better?
this is
Is that
a
really
lot
so
of
much
people
better
dying.
than, and it's like I would be fascinated to look at, countries that do have socialized medicine. How much of a problem is it really that people are trying to get medications or procedures that they don't need? I mean, I would imagine, just, putting on my sort of logical thinking, that, I mean, maybe if certain medications are, being used illegally, like I understand amphetamines are, a controlled substance. Okay, maybe people are trying to get that, but like barring somebody with a really deep-seated psychological condition that needs its own treatment, who's going in there like, no, I really, really, really want my gallbladder taken out. Like, like I'm just deeply passionate about gallbladder removal, and I want you to do that to me. Like, that, like, I'm just, what does fraud and abuse look like in healthcare, in a socialized healthcare system? And why are we so afraid? What are we afraid that people are going to do with this? I mean, I remember being in middle school, and a friend of mine saying, who grew up in a very conservative household, saying like, oh, well, you know, you can't just give everybody healthcare, then people are entitled. And I remember thinking, I mean, I think people are entitled to healthcare.
Yeah,
But again, it was said like such a bad thing. But I no, I think, I mean, I think healthcare is a human right at the end of the day.
yeah, and when you look at in this documentary, one of the statistics that they used was they estimated that 18,000 people would die in America in 2007 due to being uninsured. That was the estimate when before this movie was released in 2007. The actual number, according to a 2009 Harvard Review article, was closer to 45,000. So 45,000 people died in 2007, thereabouts, um, because they did not have insurance or did not have access to healthcare. And it is this weird belief that it is better for those people to die than for somebody to get healthcare that they didn't need, because that might cost me something. And as somebody who has worked in insurance, the misunderstanding of how healthcare works is astounding, because this idea that I don't want to pay for your healthcare, what do you think insurance is? They're not taking your insurance payments and putting it in an envelope in an office and then handing it back to you when you go to the doctor. They are pooling everybody's money, and all of that money goes to pay for everybody's health care. They're just taking out money to pay for the CEO and the shareholders and all the people that are working at the insurance companies and all the other stuff. It is the same as socialized healthcare, except it is infinitesimally worse because they are robbing you blind while they are doing it. But they've
Yeah.
convinced everybody that somebody getting to you paying for somebody else's health insurance is wrong. Well, that is what you are doing now.
Well, and the same with, and in the documentary they did such a great job of showing this, like, oh, in these places with socialized medicine, you have to wait months and months and months to see a doctor, and you have to do this and you have to do that. And I mean, one, I can say as an American, I can't tell you how many times I got a call, I think 2 weeks ago. It is March, so this would have been in the end of February. I got a call that was like, hi, we saw that your doctor put in a referral back in May. Did you want to make an appointment? And luckily, with that particular issue I'd already taken care of with a different provider. But I was just like, imagine if that had been a like a really if I hadn't been able to get treatment elsewhere, or if that had been like a time sensitive issue where, you think about things like certain kinds of cancer, so many kinds of cancer. It's, you got to catch it early, you got to catch it early, you got to catch it early. And as much as we want to, the fear mongering of, oh, well, if in these other countries you have to wait forever to see a doctor. What do you think is happening here? Or what do you think is happening for people who, if not uninsured, are underinsured and are putting off going to the doctor? And then again, instead of treating something very early on when it's easier to treat, you're catching it way too late, and then it's, more expensive to treat, harder to treat, and you're not going to have as good outcomes. It's
Yeah.
just,
Oh, for
again,
sure.
whenever people are like, oh, so many people can't get healthcare, so many people can't see doctors in these socialized countries, which I'm like, one, that doesn't seem to actually reflect reality. And two, that's what's happening here. Like, wait till I tell you what's happening here, buddy.
Yeah, in December, I needed to set an appointment to see my GP. And I keep in mind that I am part of a concierge program where I pay an extra annual fee to have direct access to my doctor. Like, so I am up the line. It's a very small practice. So I got to see her last week. And, and so at the end of February was when they had something available. So it was 8 weeks. And she has recommended that I go see a sleep specialist, because she thinks I have a nightmare disorder. And I think she's probably right, but I have to see a sleep specialist and go through the
Yeah.
the testing to determine that. And they're not going to be able to see me till June. Um, so
Well,
like we're we're waiting for medical care here, despite the fact that one, I have really good health insurance, and two, I pay an extra fee to have direct access to my doctor as part of a concierge health insurance or a concierge health service. And I still have to wait
yeah.
months and months and months to get any kind of treatment.
And you think about, so all the people who work in at health insurance companies, all the people who work at health insurance companies, what if all those people were instead being able to, work in medical fields actually helping people, instead of all these time and resources going towards health insurance companies, what if that went towards, healthcare workers? What if people could go to medical school without fear of crippling debt? I think we'd probably have more nurses and doctors, and if people were able to see them because money didn't have to go into the pockets of healthcare CEOs. Oh
Well,
God.
and they
It's
actually,
infuriating how many problems you can solve with money, but we don't.
for sure, and they actually address in the documentary, he talks to people who work in the health insurance industry. And they're
Yeah.
crying while they're talking to him about, I've been forced to deny healthcare to these people. It is my job as a medical reviewer to deny at least 10% of all claims that come through my desk. Like people who have left their jobs because they are being forced to treat people inhumanely, to earn a paycheck. And
Yeah.
that is, uh, I cannot begin to explain to you how real that is. I worked in the member services department, for a health insurance company. And at the end of the day, I would just hang up the phone and I would cry because you don't know how upsetting it is personally to have your day be getting calls from people who are standing in an emergency room with their son with a broken arm to be told, oops, your employer didn't pay their bill. You don't have health insurance right now. Like,
Yeah. It's
it,
just, it's so, and and to me, I also wonder from the perspective of a doctor, it seems like if you go work as a like a reviewer for these things, it sounds like you can make a lot of money for probably less work and less liability than you can
oh, for
actually
sure.
go and practice medicine. Like that's what, and from the perspective of, if you are an individual and you just are trying to look out for your own family and you want to make sure that you don't end up in medical debt, you want to make sure that you can pay for your kids college, well, that's going to incentivize you to go work for these healthcare companies. I mean, I hate the phrase healthcare companies. Like, well, I want to call them like illness profiteers. You know what I mean? Like that's what they are.
That's a more accurate title. Um, but yeah, and I also worked for a different health insurance company, and I worked in provider services where I talked to doctors' offices all day. And I was not allowed to tell them why a claim denied. So if they called and a claim was denied, I had to be like, well, you can review it and try to resubmit it and maybe we'll pay it. So I couldn't tell them, oh, you typed in the date of birth wrong. or oh, you've coded this incorrectly, or like I wasn't allowed to tell them, and it got to the point where doctors' offices, no, instead of hiring people in office to handle that work, they um they outsourced it to other countries. And literally I would get people with very thick accents calling me, and they'd be like, please reprocess this claim, and I would reprocess it, and I'd say it denied. They'd be like, okay, click. And that was the effort that was getting put in to try to reprocess the claim, because it was cheaper for them to just let the claims not be paid than to pay staff to reprocess all of it. It
Oh
is
my God.
designed to be frustrating and difficult, and it's designed to make it as hard as possible to get the care you need, and as hard as possible to get paid for the services you render when you're a doctor.
It's just awful. Like again, I want to keep, I want to say who benefits, but well, healthcare CEOs benefit.
Yep. And not just CEOs, but their whole board of directors and their
Yep.
shareholders, and like everybody who's at the top of the earning potential there, they have monetized human suffering. And the more human suffering they cause, the more money they make. And that is their business model. And they're going to fight like hell to make it so that you can't stop them from, earning a paycheck off of human misery.
Yeah, it's just beyond it's just beyond inhumane. And I think one of the things that is so infuriating about, I mean, companies in general is that companies can kind of operate with impunity, and there's an extent to which I understand that if you work at a company and even if you run a company, and this is general, not healthcare companies, but like it's not right that you should necessarily be held personally liable for anything bad that might happen at near with your if you own a cab company, if you own a cab company and one of your cabs is involved in a wreck and there's a casualty, that's not necessarily your fault as the owner of the cab company, and it makes sense that we would have a measure of protection. However, I think sometimes we have too much protection from individual liability in these kind of corporate models, because if you own a cab company and you decide to save money by removing brakes from all your cabs, i'm I'm being ridiculous here, but you get what I mean. Just any kind of, if you're making a decision that's going to circumvent safety, or something that any reasonable prudent person could say, hey, that might cause a problem, and you do it, and it causes a problem later and people get hurt. I think we need more liability, because unfortunately these healthcare companies, they can get away with it because no one's holding them accountable, because you can't be charged with criminally negligent homicide or depraved indifference, even
Yeah.
though that's kind of what you're doing.
Oh, yeah. And I think it is interesting to me because this documentary happening in 2007, the ACA was passed in 2010. So 3 years after this documentary, the ACA was passed. And that included a bunch of things, but the two big things that came with the ACA was, one, you could no longer be denied coverage due to pre-existing conditions. And two, you could have access to purchasing health insurance on your own through the ACA website. You could go to the government website, you could buy a policy. It did not have to come through your employer. And so that was the two big things that were beneficial to individuals when that all passed through. And so when they talked to, in the documentary, they talked to a guy named Lee Einer, who was an insurance employee whose job was to look for any reason to cancel coverage or deny a claim by reviewing your medical history and your insurance
Right.
application
Yeah.
to see, did you ever have a cough you didn't tell them about? Did you not fill something in all the way? It was his job to find ways to make it so they didn't have to pay your claim. And that particular type of job would have changed tremendously at that time, because they could no longer go back, like with one woman in the documentary, and say, you had a yeast infection once, you don't
Yeah.
get coverage. um, but that is in this lead up to the Brian Thompson shooting. Part of the reason that we that the general public believes he was shot is because he set up a system to automatically deny 90% of claims. And
Oh
so
my God.
so they could no longer deny claims based on, whatever freaking reason they thought was appropriate and to before the ACA. But now they figured out, and this is not just happening in healthcare, it's happening in a lot of insurance industries, where the new process is we're just going to deny it and you have to fight it to get us to pay it. And they know that a certain number of people will just let it go because it's a small enough amount of money that it's not worth fighting. They know a certain amount of people are not going to be able to figure out how to fight it. And worst of all, they know that if they hold out long enough, eventually you'll die and you can't
Yep.
keep fighting it. And so they are denying claims for cancer patients and people with chronic illnesses and things in hopes that you're going to die before you have a chance to fight them to make them pay the claim.
Honestly, what you said about insurance companies essentially just waiting for you to die, that reminds me a lot of the story of the radium girls who, they were poisoned. Essentially, they were poisoned knowingly by their employer, the US, I think it was the US Radium Corporation or US Radium Company. And when by the time they realized what had happened and by the time they were able to sue the company, the the company just kept putting it off and putting it off and finding reasons to delay it because the women were dying. And they knew that when there were no more plaintiffs, they would get off scot-free. And again, it's that thing of, as a corporation, no individual was going to go to prison for that. But again, there comes a point where there comes a point when I think that we need to stop letting it just be, well, this is part of my job, or, well, it's the company I work for. It's not my fault. Well, no, if you're in charge of a company and these are your policies that are in a very real way hurting and killing people, you need to be held accountable for that.
Yeah, and it
And
impacts
yeah.
literally every person in the United States. I don't know if you remember, but it must have been like a decade ago, like uh, 2015, 2016, something like that. There was a big news reveal that Joe Biden's son, Beau, was dying of brain cancer, and Joe Biden was going to have to sell his house to pay for the medical care. And Obama stepped in and offered financial assistance so he would not have to sell his house. The
Oh wow.
president and the vice president of the United States of America had to band together, and one of them had to help the other pay their medical bills. Why is the president and the vice president, if they cannot avoid all of the bullshit that is this system, none of us can. Like, how much worse is it for those of us who are working regular jobs or don't have that kind of money or that kind of power? I would have imagined that as the vice president, he could have gotten his son all kinds of treatment, like access to things. And I cannot imagine any doctor would have said, "I'm sorry, Mr. Vice President, we're not going to treat your son." And yet he was still in this situation where he had to be offered money by his boss, essentially, um,
Yep.
to cover his medical bills.
Yeah, it's just it's that thing of I mean, it's such a all these problems are intertwined. Healthcare, poverty, crime, like all of these things are so intertwined. But like, I think in America, again, we have this very like Protestant work ethic, pull yourself up by your bootstraps. I mean, really, it's Protestant work ethic and Ronald Reagan, who I blame for so many problems in this country. Those are the two main ones. Um, but this again, the Protestant work ethic of like you just have to work harder and and provide for yourself, and that mindset is just not a reflection of reality when it comes to, I mean, I'm trying to remember now like the exact statistic, but I think most bankruptcies in this country are caused by medical bills.
Oh yeah,
You know,
I believe it's the
again,
vast majority of bankruptcies
yeah,
are due to medical bills.
like because I think there's always this idea of like, oh, if you're poor, it's because you're irresponsible with your money or whatever. And it's just that's just not accurate. It's not right. And I also I can't even imagine, I think a lot about parents of small children and you know, how do you like I remember in my own teacher training, one of our sort of units was learning how to spot signs of child abuse. And one of the symptoms, of course, like a symptom of neglect can be, if they're not being medically treated, or if they're being like malnourished, if they're not being fed. And of course, it said like, oh, except if they're not being fed because the family can't pay for food, then it's not a neglect issue. And I kind of kept waiting for the part where it showed us how to help families that may be dealing with that. And it's this weird thing where it's a criminal act if it's intentional, but if it's circumstantially unavoidable, well, that's just the way it is. And again, as a country, if I mean, again, thinking about like Guantanamo Bay, yeah, if and not that I'm saying like, oh, I bet prisoners in the US get only the best, because I feel confident saying that's not true. But if we have like prisoners in this country who need, medication, and we say, no, sorry, you don't get any, that would be a violation of human rights, as it should be. But
Yeah.
if the country allows people to go without those same things just because they're poor, that's just the cost of doing business.
Yeah. And the worst part of all of this, I think, is that our society is built around and designed around the idea of punishing people for doing bad things and not preventing bad things from happening in the first place. And so while there is no money available. There are very little money available to help kids whose families are impoverished and they can't eat. They can't feed themselves or have, hot water or medical care or whatever. There is plenty of space in jail for those parents, and kids can be, shuffled off into the foster care systems. And most of the time, that does not happen. I truly believe that most teachers are very understanding of the situation, but it's
Oh yeah.
designed to punish, not to help. Like,
Yeah, it's that weird, it's the idea that like you could be doing more and you're just choosing not to, which is just a fundamentally incorrect assumption. And I mean, and to me at the end of the day too, is I'm kind of like, okay, let's let's assume that out there are some parents who are just lazy, don't want to work, don't care about their kids, and don't want to bother taking their kids to see the doctor. Like, for the sake of argument, let's assume that there's some out there that are with no complications. They are just bad people who want their children to suffer. I still want those kids to have health care. Like, I still and I think that's one of the things that a lot of people don't think about, again, when they say like, oh well, free healthcare, that just makes you entitled to be lazy and not get a job, or whatever it is that they think. I'm just trying to think of all the various weird arguments I've heard, and I'm like, okay, but it's not just the adults who are suffering, it's also the children in their care. And again, it's like, who does that benefit? Who does that help?
well, and honestly, the idea that people want to be slugs, they want to lay around and do nothing and just have everything handed to them by everyone is the least accurate thing I think I've ever seen. I can't tell you the number of impoverished people that I have run into in lines for food banks or, at various things, and they're writing a book or they're doing like that. People want to work, like they want to do things that contribute to society. You may have a small handful who don't. I'm not going to say that there's nobody in the whole world
Yeah.
that would ever avoid contributing to society, but people want to participate. And the idea that people are just looking to sit around and take all your money to pay their bills so they don't have to do anything is the exact opposite of everything I've ever seen of anybody I've ever interacted with.
Yeah, like I mean, I think about, because I used to work in Boston, and I remember like the number of times I would see like unhoused folks, they would essentially like give themselves a job of like doorman at this convenience store. And like, yeah, I guess if you want to be really cynical, you'd be like, oh, well, they're just there so that they can like beg. I'm like, well, they don't really have another way to make money because, if this person has no address, no clean clothes, no ability to care for themselves, how are they supposed to get a job? But I'm like, at the end of the day, I think they just wanted to feel like they're participating again, like they're participating in society, like they're helping, like they're doing something nice. And, you know, I mean, and that's, never minding the overlap between severe mental health issues and homelessness, of people aren't homeless because they're lazy. People are homeless because they're again they're bankrupted by medical costs because they're too sick to work. They're too, and I think countries that have implemented any kind of like universal basic income, they find that the vast majority of people, again, like you said, they want to work, they want to contribute. And the folks who don't, usually it's because they're students, they're disabled, they're elderly, or they're parenting young children, and like I can say for myself, I mean, I had to be on medical leave from work for a significant portion of this year. And I I needed, my situation was very complicated, but I I didn't like feeling like I wasn't doing anything. And again, not, when I say contributing, I don't mean that like be a good little worker bee and create wealth for somebody. I mean, we want to feel like we are part of society, want to feel like we are doing things. Like I think so much about all the people I know who, if they could spend their time, if they didn't have to work at a health insurance company denying other people's claims, what they would be doing with their time because they're passionate about, animal rescue, because they're passionate about art, because they're passionate about whatever. And I'm like, that's such a better use of everyone's time and money,
Oh,
keeping everyone afraid. Like fear
for
is
sure.
I think we don't realize necessarily how much American culture is built on fear. And we can talk about it in terms of like the fear of socialism, the fear of other countries, but at the end of the day, it's the fear that we're going to lose everything we have because we got sick, because we became disabled, because whatever, because we can't afford to be without our job. And it's like, what would life look like if instead of having to stay at work, having to do this, that, and the other thing because you're afraid you won't be able to survive otherwise, what if everybody knew that they would be okay, their basic needs would be met? What would that society look like? Because I think it would be a hell of a lot better than what we have now.
Well, and it would be better for literally every person in the United States. At one point in the
Yeah.
documentary, there's a quote that the poorest people in Britain can expect to live longer than the wealthiest in America. And that's true. The poorest people in Britain can expect to live longer than the wealthiest in the United States. That is in large part due to the fact that they have universal health care and that this is not restricted for you. Because, I mean, my family is not impoverished by any stretch of the imagination. We're in a weird situation right now where I've been unemployed for several months and I'm kind of trying to patch things together and getting unemployment to pay the bills. But we're not in any kind of financial precarity, and we have not been for the last several years, but we have still missed out on medical care because to be able to go get the care you need, there's a $3,000 deductible, or because there are other costs associated with medication or with what have you. And I remember in 2021, I was freelancing. I hadn't gotten the job I'd had yet, and the pandemic was roaring, and I was in the kitchen, I was cooking, and I had the electric mixer with the where you
Yeah.
put in the beaters, and I was snapping a beater in, and I got a metal splinter in my thumb from
Ooh.
from the beater.
Oh, that sounds horrible.
And I looked at it and I thought, I can go to the doctor and pay $400 or $500, towards my deductible to have them surgically remove this and sit there and hope to God I don't get COVID because I'm in a medical facility in 2021 and that's what it is. Or I can get a bottle of rubbing alcohol and some tweezers and a magnifying glass, and I can do this myself. And I did. I sat in my bedroom with rubbing alcohol and tweezers and a magnifying glass, and it had broken into like 13 or 14 tiny splinters. And so
Oh
I sat there
God.
for like an hour pulling these splinters out of my thumb because the cost and the danger associated with going to the doctor was too much. And there are entire manuals. You can go online and look. There are people who have to do this stuff themselves and will tell you, here's the medical uses for duct tape, and here's what you can do with super glue, and here's what you can do at home to take care of these things. People are having to stitch themselves together and do their own medical work at home, Dr. Frankenstein style, but you don't get a cool monster at the end of it. You just maybe don't die.
And that's just wild. And something that you said also made me think, because you said, it might cost you like $500 or something like that. One of the things too that I remember being pointed out to me recently, and something that the documentary did a great job. I think there was the woman who, what her inhaler was 150, and it turns out it cost 5 cents. Is that if you if you look at a medical bill in the US, if you think it actually costs this many thousands and thousands of dollars to take an ambulance ride, to get your broken arm set, to whatever, of course you think there's no way we can pay for all of this, because but it's like that's not actually how much these things cost. Or again, you want to say like, okay, well, if an ambulance ride is going to cost you, I don't know, $700, whatever, and the EMTs are making $15 an hour, where's all that money going? Because it's not into your health care.
Yeah,
It's
that's not the first time that question has come up in this podcast. Where is all that money going? Because EMTs aren't getting paid. Doctors, even like people with serious medical degrees who have went through $180,000 of debt to get through medical school and all the end, get to the end of it, and they're maybe, surgeons and specialists are maybe making good money. But if you're a general practitioner or like an OBGYN, if you make $150,000 a year, that's probably pretty good. And you have
it
$200,000.
sounds pretty good to me.
Yeah, but you don't have
Yeah,
$200,000 in debt to get to the
I do
point where you
not.
can earn that money. The entire system is built so that it's siphoning money out and giving it to it's rent seeking. It's giving it to people who are putting themselves in the way of your having the things you need. And it's just surreal to me. And I know I have been told by friends of mine who are from England and stuff that, oh, oh my God, you think it actually costs that much to receive care? If I broke my arm and I went into the NHS and whatever, like I would not pay anything, but the actual total cost of services and the cast and the x-rays is maybe $600. It's not the $12,000 you're going to pay in the United States. Our system is designed to make it extraordinarily expensive.
We're paying designer prices for really basic goods for no reason other than that's how insurance companies can make money. And that to me too is like that just floored me in the documentary, was the moment where it was recordings of I believe President Nixon talking, right? Yeah, Nixon talking about like, oh, I excuse me, like I don't like any of this socialized stuff. I don't want this. And they're like, oh well, no, the purpose of this is, it privatizes it, and the money goes to like less care, and or the it incentivizes giving less care. And he's like, oh, this is great. And it's just that like, oh, it was that simple for a couple of men in a room to decide this was the way to do things. And again, you compare that to the doctor in Great Britain who is incentivized for his patients to stop smoking, to have, low blood pressure, to have this, that, and the other thing. There's
Yeah,
I
I
feel like just in America we're so money focused. We're so focused on like on money and what should make money and who gets paid and how and why, but kind of all in the worst ways. Where we're again like, I don't want to pay for the health care of somebody who makes a bunch of really bad health choices. Like, okay, well, maybe if this person had gotten health care all their lives, again, this big expensive problem that they have now maybe could have been caught when it was a far less expensive problem a long time ago. And also at the end of the day, they're a human being and they still deserve care no matter what their issue is, or who you think is to blame for their whatever their health problem is.
Yeah, this actually, watching this documentary made me wonder how much this approach to healthcare contributes to the misogyny within the health system. Because I know
Yeah.
that you for sure, and I for sure, and every other woman in this country has gone into a doctor's office and said, "This is a problem." If they've said, "Have you tried not being fat about that?"
Oh
or
yeah. Oh yeah,
or
that's a big one.
this is anxiety, this is not a real medical thing, you need to go home and not and so they are incentivized. Okay, I now get the money because you've stepped foot into my office, but I don't want to treat you because that's going to take extra time and extra resources, so I need you to get out so the next paying person can come in here and I can tell them they're too fat.
That's the other thing too, is I'm like, I mean, I don't I'm like, how much does how is a doctor's salary decided? Is it by how many patients they see? Is it an annual thing and it's how many hours they work? I mean, Lord knows I don't know. I mean, I'm still punching a clock. I have two master's degrees and I'm still punching a clock for not a whole lot more than minimum wage in the state of Massachusetts. Like, and that's its own thing. But you know, I
Well, my
yeah, this
understanding from having worked in health insurance, my understanding is that doctors are given 15-minute increments in which to see people, and that's what you get paid for. And if you go beyond that, you're losing money, and then you are now being dinged by your health insurance company because you're not seeing enough patients. So it is in their financial best interest and their interest in maintaining the health insurers that they work with to get you out, so they are not incentivized to treat you. Unlike the doctor in Britain who said he gets bonuses if he can encourage you to
yeah.
make healthier choices, or if he can catch something early and it doesn't become a huge thing. That's when he gets a bonus. He earns more money because he took proper care of you.
Yeah. Again, it's how are we prioritizing and incentivizing actual wellness and not, again, treating this like a cash cow and like a cash grab. Yeah, I can't tell you how many times. I mean, especially like I mean, I have a chronic pain disorder and oh my God, the number of doctors I had to see and who I had to explain, this, that, and the other thing. Or, even recently, I remember I had a doctor who was basically like, well, you need to exercise more. And of course, at this point, I was in grad school. So I was in grad school for theater and I was specializing in stage combat. So I was like, all right, I'm sword fighting for 12 hours a week. I was also teaching swim and I was a tour guide. Like, you let me know how, like, I was not living a sedentary lifestyle. I think, hey, you need to exercise more. That may be true of some folks in some situations, in some contexts, absolutely. But for me, it just absolutely wasn't. And just trying to explain to this doctor, no, no, that's not actual applicable advice to me. Again, sword fighting alone, 12 hours a week. I'm a pretty active person. I need you to actually treat my symptoms, not just tell me to exercise more.
Yeah, in 2023, I had a leukemia scare where they
Oh,
had taken blood and my inflammation levels were off the charts. And they were very concerned that I might have cancer, but that there might also be other causes for this. And I said, okay, but here's my deal. And I went into my hematologist and to my GP and everybody that was involved in this. I said, this is fine. I want you to assume to take my weight into consideration as the last possible piece of information. So if you were going to treat a thin person, what would you do for them? And then if that doesn't work, then yeah, we can talk about maybe weight loss is a problem, or maybe this is aggravated by weight, or what have you. But there is no world where I'm going to stand here and have you be like, oh, well, if you lost weight, maybe your inflammation levels would come down, and then find out in 7 months that no, this was leukemia. We're not playing that game. And
yeah. Good for
so
you.
I had to be very upfront with them. And it turns out that they are almost 100% certain I do not have cancer. They keep a
Yay.
they keep a close eye on my inflammation levels, and if it goes up a little bit or whatever, like they're very concerned and they're on top of that. But there are people who probably dealt with the exact same situation I did, who went into doctors who were just like, "No, you should lose weight."
Oh,
And
100%.
they just the cancer just riddled, ran through their body, and they were left to die because their doctor was like, "It would be easier for me if you would just get out of here and be less fat."
Context is so important in health.
It really
Context
is.
is so important in health. I mean, I
And
like even just little things. Like I remember going to a doctor once because I was having a problem with my wrist and again trying to explain like I fight with swords all the time and he's like, "Well, you shouldn't do that." And I'm like, "Okay, that's not helpful. This is part of what I do for my job. This is how I make my money. You're not treating me as you're so focused on the acute issue, you're not looking at the big picture of like me as a person." And that's a problem because it's actually now impeding your ability to care for me effectively.
yeah. And they talked in the documentary about how in Canada and England and France and Cuba and the countries that they went to as part of this documentary, that those people in those nations have lower rates of cancer and heart disease and hypertension and diabetes, and that socialized healthcare gives people much better health outcomes in large part because they have that baseline. They're not waiting forever to go into the doctor to be like, "Oh, well, it turns out that I've had type 2 diabetes for 2 years and I just didn't know about it." If they could have caught it 2 years prior, they could have maybe addressed it and had it not turn into a problem. And their whole system is designed so that people are treated regularly, and their health is a reflection of that.
Yeah, I mean, not to mention, I mean, how many medical issues are exacerbated, even if not caused by stress. And I mean, financial stress, that is a huge stressor. Never mind the sort of compounding issue of if you get too sick, you can lose your job or have to leave your job. And then that could in turn make you lose your health insurance. So now you can't get treated for your illness. And it's just this vicious feedback loop. And that's not going to help your hypertension. That's not going to help, or you think about how important sleep is to health and wellness. And, if you're, it's one thing to have a generalized anxiety disorder, another thing to be, if your generalized anxiety disorder is fear. I mean, I guess I don't want to say, I don't want to, I just want to be very careful here. I don't want to at all be dismissive of mental health issues because I mean, hey, hi, um, I got them too. But, there's a difference between a very real and rational fear and anxiety over something that's very possible. You know what I mean? It's to to be stressed and terrified that if you miss a shift because you're sick, you're not going to be able to make your rent. That's going to impact your health, and that's going to make things not good. Years and years of stress that builds up. It's all very, the body keeps the score. Like these things, they live in your body and they literally make you sick. And I think about if people didn't have to be so terrified of medical debt, we have the vicious cycle. Now we have like the positive feedback loop of you're healthier because you're able to see a doctor, and you're able to see a doctor without having to worry about it, which makes you healthier because you're not so laden with stress and anxiety about it. And it's just, we could have such a better world and such a better country,
Well, and I wonder how
but we
much
don't.
our general anxiety, like our societal anxiety, because Gen X, millennials, Gen Z, we all have anxiety pouring out of our ears. It's
Yep.
like we're manufacturing it in the garage for fun. Um, and I wonder how much of that anxiety is created or exacerbated by living in a society that does not value you, that
Yeah.
is fine if you die. They would really, you not being here would not be a problem for them. That, they treat you very poorly, and everybody always treats you like you're up to something, like you're trying to steal from them, like you're trying to make life hard for them. I wonder very much how much of our societal anxiety is built into the way that we treat each other like that.
Yeah, like I mean I think a lot about I saw a post once online that was basically like, you know, inability to access food is a mental health issue because I can't give somebody, if I give somebody meds that they need to take with food, but they don't have food to eat it, now they don't have access to their mental health meds. Racism is a mental health issue because how can I as a physician help ease someone's anxiety when their anxiety is I'm going to end up a hashtag if I'm in the wrong place at the wrong time. That's not an irrational fear. That's a very unfortunately real anxiety that people carry around. It's one thing to be able to manage anxiety that's kind of organic, maybe, of just like, okay, your brain's a little extra anxious, versus anxiety that's, again, I'm afraid I'm going to get sick and miss a shift and not be able to pay my rent and get evicted, which is a very different type of fear.
Yes. And you could see that even in this documentary in Sicko, when he was talking to the people in France, he had gathered a group of expats, people who were Americans living in France, talking about what it's like living there. And they are talking about they have unlimited sick time and 5 weeks of paid time off a year, and they're going through all of the benefits that go on. And he's like, well, you guys are talking like people will come to your house and do your laundry from the government. And they're like, yeah, they will. If you just had a baby,
Yeah.
they will send somebody to your house to do laundry and cook and kind of help you maintain things so that that first year of your child's life, you're not losing your goddamn mind because because you're just so exhausted and you're having to work full time. Like they want life to be pleasant for you. And in
Yeah.
America, it seems to be the exact opposite.
I mean, it's like you said, it's this weird like focus on punishment and on like it's this we're so much more afraid of maybe people will get more than they deserve. We're more afraid of that than we are of maybe people are not getting what they need. And I'm like, I think there are plenty of people out there who are getting more than they deserve, but it's because, again, they're, wealthy CEOs whose workers make next to nothing. Those are the people who I'm worried about getting too much, not somebody who's on food stamps, maybe getting too much, quote unquote. Like, which what even does that mean? Yeah, I was also like curious. I'm like, is there a stock market in France? Like, I have no idea how, like,
Well, and
stock finance stuff is so outside of my like realm of knowledge. But I'm just like, what, or is it just that it's inherently different because, healthcare companies aren't on it?
I imagine that there has to be stock market type things in every country. There has to be
Yeah.
investments and business things in pretty much every country. Um, and we know for sure that people who are part of the stock market here, Wall Street brokers and stuff, have to sometimes get up really early to be awake with the Asian markets. And like this is clearly this stuff exists everywhere. But I don't know how those things function there, and I imagine that in France they would run you through a guillotine if you said no, my profit is more important than your life. I
Yeah.
imagine that the French would disagree.
Yeah. Again, it's just this like, again, what if the power was in the hands of people rather than of corporations? Like, what if the priority was, again, making sure everybody's basic needs are met rather than making sure that no poor person ever gets anything that they didn't have to fight and claw and, you know, run themselves into the ground trying to get. Like, it's just so backwards to me. And one thing I did love that he pointed out too in the documentary, he's like, we have plenty of things that are socialized in this country. We have socialized education. We have socialized, like fire departments and police departments, and and I think one of the things that's like so American is this weird idea of like we hate taxes. It's like, yeah, maybe we hate them because we don't see the benefits of them the way that other places do. Like we don't
Yeah, I think we
we
maybe
don't have
see
those to rely on.
we see less of the benefit of that, in part because it goes to like military and things that are
Yeah.
not immediately visible to us or are visible in very negative ways. But also, like, I think people have this idea that what we have is what makes us American, and that criticizing that is criticizing America and criticizing them as individuals for having that kind of patriotism. And it's really not. Like in 2006, but when this documentary was being made, the United States was 27th in the world for healthcare. So we were slightly ahead of Slovenia, like in the list of global
Yep.
countries. As of 2024, can you guess where we rank?
Oh God. What were we
We
before?
were 27th in 2006,
Are we 34th?
70th. We're
Holy wow.
right above Algeria. That is where we are on the global scale of health. Like, seriously, America has the worst infant mortality rate in the Western world. A baby born in El Salvador has a better chance of surviving than a baby born in Detroit, is one of the
I
statistics.
remember when Serena Williams had a baby and she nearly died. And I remember again having that moment of, oh my God, if Serena Williams can't get decent maternal health care. And of course, with her, there's also the just the compounding issue of racism and so if Serena Williams can't get decent health care, again, kind of like the Biden question, who can? And it's just so again, like,
Yeah, and with Serena Williams, you can't say that, oh, well, if she were healthier, if she made better health choices,
yeah, it's like
there
she's
is
a
nobody in the world that is
world-class
healthier.
athlete.
Like, yeah, I imagine that the situation is so much worse than we understand here on the ground in the US. Like, if I think if people understood just how bad it is here and how much better it is other places, they would riot. And that's part of why we get lied to so strongly. Like in the documentary they showed where Republicans came out very clearly, bald-faced lies, and screaming about how they love their mothers just as much as everybody else and they would never hurt their mothers, and how dare you judge them on that. And Ronald Reagan released a whole entire audio album about the dangers of socialized medication, because then you can't choose your doctors and your pharmacies and all of that. But I got to tell you, this week I was forced by CVS to switch my prescriptions to a CVS pharmacy, even though I don't want to get my prescriptions there. I have a lovely local pharmacy with local pharmacists who know me and I love them and they contribute to my local community. No, I have to go to CVS. They won't cover my prescriptions there anymore.
I
So,
recently had to change a prescription, not because my doctor said that I should, but because the health insurance company said, no, you need to go on this other medication too. Like, or you need to go on this other medication instead, which also meant I had to, just with the kind of medication it was, it's one of those, like with a lot of medications, you kind of got to figure out your dose you got to figure out what's right for you. And I had to go right back to the lowest dose of this new medication because basically the doctor was like, in changing you over from the old one, I don't want it to be too much. And it's
right.
just like, again, like who does this benefit? Like it's not benefiting me to have to now figure out on a whole new medication what I need, or I
Well,
had
and this
the
is the thing that
like
they scaremongered. If you have socialized healthcare, you won't get to choose your doctors. You won't get to choose your pharmacist. When I lost my job in October, we lost our insurance. We had to switch to my husband's insurance. Now I have a whole new slew of doctors to choose from that may or may not take that my new insurance. And I now have to figure out, okay, am I going to pay out of pocket to see the doctors I know and like, or am I going to use my new insurance to see a different doctor? They're forcing me to go to a different pharmacy. None of this is acceptable or okay. And it's everything that we were told would be horrible about socialized healthcare is what's happening to us right now.
and also like this whole, you have to worry about, oh, is it in network, is it out of network, is it whatever. Well, if everybody had all the health care, all the doctors would accept all the health care, and that wouldn't be an issue. It
Yeah.
just it doesn't actually make sense. It doesn't actually like hold water when you think about it, and
And I will
it's
say
it's
that
wild.
they talked about how in 2007, 50 million Americans were uninsured. After the passing of the ACA in 2010, um, there were 26 million uninsured Americans. So we got less than half of the uninsured population gained health insurance during that time. And the entire Republican side of everything acted like we were trying to rip the teeth out of their mouth, screaming and
Oh God,
screaming
yep.
about how damaging this was. It still didn't address the problems. It was better because it means that you can't be denied for pre-existing conditions, but it still was not a solution.
Well, and I remember seeing people that were, that would be interviewed on the street where they'd say like, how do you feel about the Affordable Care Act? Oh, I like it. Well, how do you feel about Obamacare? Oh, I hate that. Well, that's the same thing.
Yeah.
Or I think about the show Parks and Rec, which just gets so much right all the time. Where I think Leslie says like, our healthcare plan at the in at the Pawnee government is not great. I mean, I one time I broke my wrist, and they told me that having a wrist was a pre-existing condition. And again, it's that thing of other countries, that's just your medical history. That's not a pre-existing condition. That's just your medical history. Because again, it's you're you're a person, you're a human, you have a body, you have needs. It's not a business. Some things just absolutely should not be run for profit, and healthcare is one of them.
Yeah, in 2007, 2008, maybe? No, I guess it would have been 2008 or 2009, and all of the verbal lead up to the creation of the ACA, where everybody was in the news, like screaming about it back and forth. I was at a health insurance dinner. Like the health insurance company I was working for at that time was having a big Christmas party, big holiday party, and it probably was six figures of a party for the people that were there. We were meeting with other people from other health insurance companies, and it was at Cipriani in New York. I don't know if you know that, but it's a very expensive restaurant. And I was standing there with my glass of tea because I don't drink, and everybody else had, wine and scotch and whatever. And I was talking to somebody, and they were talking about they were planning, the industry moving forward was planning about a 20% increase in rates from 2009 to 2010.
Oh
And I
God.
said, wow, 20%'s a lot. Why is it going up that much? And they said, well, with the ACA, we don't know if we're going to be able to raise rates after that anymore. So we have to get rates as high as we can right now. That was their reasoning. Not we have, expenses or whatever. It was we have to raise rates as high as we can, as fast as we can, because there might be restrictions on us in the future.
And again, it's like this is healthcare. It's not, it's healthcare. It's not a a trendy, piece of clothing that's like, oh, we can make this more expensive because suddenly this is super popular and everyone wants one. It's healthcare. It's just like that shouldn't be allowed because again, it shouldn't be run like a for profit industry because it's people's lives. Like we shouldn't, again, you want to talk about like incentives, we shouldn't be incentivizing allowing people to die or allowing people to just live with, treatable or manageable conditions, but we're allowing them to live, so much, in so much more like pain, physical, emotional, both, whatever, just because somebody else can make money off of it.
But
And
and even
it,
within the documentary, we saw that he had a whole portion where he talked about American hospitals just dropping patients on the street, still in their hospital gowns, when they knew they couldn't pay a bill. Just
yeah, and again, it's like this isn't somebody who went into a restaurant, got a fancy meal, and then decided not to pay. This is a person who needed help.
Yeah,
Like
the
they needed
hospitals were
treatment,
giving cab drivers vouchers to drop these people in front of homeless shelters, still in their hospital gowns.
which meant that it happened so many times they'd worked out a system of how to do it as efficiently as possible. Which
Yeah.
again, like again, talking about sort of like a company doing something versus an individual doing something, where it's like if I had, my grandma in the car and I knew that she was sick and disoriented and didn't know where she was, and I dropped her off somewhere, I would probably face charges for like elder abuse or reckless endangerment or
As
something,
you should, if that's
as
if
I
that's
absolutely should. But if it's a company doing it because somebody couldn't pay, somehow now that's okay.
yeah, it's vile, and it hurts to live in a place in a system where people are treated like that and where you are expected to treat people like that, because that is the system that's set up. That cab driver was forced to drop people at a homeless shelter knowing that they did not get the medical care they needed. The nurses were forced to put these people in a wheelchair and wheel them out to essentially into traffic and be like, get out. Like the doctors were forced to not treat people. All of this was set
Yeah.
up forcing people to go against their humanity, their innate knowledge of who they are and what is good for the people around them, and do literally the worst fucking thing you could ever do to another person. And that is your job.
I'd be fascinated to know like what percentage of like CEOs, especially in again like the healthcare industry, are like sociopaths or so, you know what I mean? It's like
I would say
just something
that's,
like how do you again, it's just that thing of like how do you sleep at night? I
I
mean,
think
I
you
feel
kind of have to be a
guilty.
sociopath to do that job.
Yeah, I mean, like I feel guilty. I work at a box office. I feel guilty when I can't get someone the tickets they're looking for. No one's dying because they didn't get to see Swan Lake. I mean, never mind actual denying human beings care. And I mean, like, and I know a lot of folks who work in healthcare, and they're incredible. And like I've got a friend who's a nurse who she has to deal with. I mean, she'd talk to me about like, oh, like I had a patient try to take a few swings at me today, and I was like, oh my God, that's horrible. Did he kick him out of the hospital? And she's like, well, no, and especially, often it's she's dealing with folks who have very severe mental health issues. And so, that's, and I mean, that's a whole complicated issue in and of itself is like, but, for her, she's like, yeah, hospital, we can't just kick someone out because they're behaving badly, even if they don't have mental health issues, even if they're just a jerk, and I'm like, and if you're being asked to shut off your humanity to the point of put this person in a cab and send them away so we don't have to deal with them, so much has gone wrong to get to that point.
Yeah, I am a bleeding heart people pleaser. Like I would open a vein to make somebody else's life easier. And I know that like my need to help other people, like I have more than once moved homeless friends into my house because they didn't have any place to go. Right
Oh
now,
yeah, I've done that.
yeah, I have reached out to every single trans person and gay person I know and said, "Hey, if you don't feel safe where you are, you come to my house right now. Like pack up your shit, you can live in my house." I have reached out to people and offered, right now I'm not working, and I have offered to pay for people to get their passports so that they are functionally capable of taking care of themselves if they need to. Like, I will give and give and give of myself until there's nothing left. And I know that. But there's got to be something between where I am and this get out of my hospital, I'm going to put you in a cab and drop you at a homeless shelter. There's got to be an in between there, like a healthy medium.
Yeah, like everyone's health matters. Everyone's health is affected. I want everyone, even aside from any like humanitarian arguments that I think are very compelling of like, don't you think people should be able to get medicine? Also, just if you want to be super coldly rational, all about yourself, looking out for number one, do you really want a bunch of people around you being sick with a communicable disease but not able to stay home and instead being in your area and possibly giving
Yeah.
it to you? Like, I guess I was really hoping that after the pandemic, or during the pandemic, we would learn as a culture and a society that we all depend on each other, and our health depends on everyone else's. Like,
Yeah, I have For the first time, I think ever after the pandemic, I was truly ashamed to be an American because we went through this huge thing all together, this massive global pandemic that impacted all of us and killed millions of Americans. And what we as a society took out of it was that was made up. Screw you. I don't need to wear a mask. And that
Yeah.
is the most vile takeaway. Even if people don't feel like they want to mask now, like make your own individual choices, that's fine. But to be able to say, no, I won't wear a mask into a grocery store or a pharmacy to protect the ill people who have to go to those places. They can go jump off a bridge. I'm just going to do me. And I'm going to take my measles infected kid into the grocery store because screw you. Like
Yeah.
that's approach that we have had as a country where we have said we went through this thing that should have brought us all together and we came out of it with more anger and hatred and distrust of one another. I feel like our country is so broken and I
Yeah.
don't know how we would go about fixing it. And it's viscerally unpleasant because at this point we're still masking. And every single time we go out in public and we're wearing masks, because we are in a state where this is more normal than other places. Like we're never the only people in masks. There's always a
Yeah.
few people who are, doing that. But I can tell you, I we drove down to South Carolina to meet my parents. We kind of met in the middle and took a vacation together. We rented an Airbnb and we got laughed at by people in North Carolina and we got like people pointing and laughing in places because we were protecting ourselves at a time when I was going through leukemia testing.
Yeah.
Like,
I remember being out in public and somebody was wearing a mask and some guy passed her and went COVID is over, which I was like, I mean it's not like it it probably never never really will be. It's like the flu. It's endemic. But also I was like, why do you feel the need to comment? Like it's not, if I see someone wearing a mask, I assume that either they're like, oh, I feel like a little sniffly and I don't want to, if I have a cold, I don't want to share it, or they're anxious about catching something, or what I'm why do you feel the need to comment on somebody else? It's kind of like if I see people carrying umbrellas and I'm like, it's barely raining, why do you have an umbrella? I keep that thought to myself because I'm like, whatever, it's not hurting me. They can do what they want to do to that, to move through the world in a way that works for them and makes sense for them and makes them feel protected from the elements. And it's just so wild to me. It's like, why do you have to be so aggressive about this? Whereas again, like in other countries, and I guess I was kind of hoping this would be the case in the US too. And I think maybe it is in certain circles, but like, I think in a lot of other countries, like I think especially in a lot of Asian countries, wearing a mask when you are sick or when you think you might be sick is just kind of standard operating procedure of like, I'm just gonna have this just as a general courtesy, in the same way that like, even if I'm not, if I cough because I've choked on some water, I'm still gonna cover my elbow, or I cover my mouth with my elbow because I don't want to be the jerk who's coughing all over everybody.
yeah, there is something about the way we have built our society here that is built on domination of other people, fear of other people. Like we have truly isolated ourselves as individuals in a way that is dangerous and deadly and harming us. Like we saw the numbers in other countries where they take care of each other, they have much better lives. This documentary was not shy about sharing the
Yeah,
numbers and you can still see it. It's 2025. You can still go to other countries and see just how much better things are there than they are here.
there's just no reason for it other than it makes a small percentage of people who are already incredibly wealthy even wealthier. And I mean, I feel guilty when I say, no, don't round up my change to donate to the Jimmy Fund at, at the grocery store. But it's just like I'm like I don't I really just don't have money to spare right now. Um
Yeah.
and there's just something so deeply sad about people who like, oh, you're working so hard to make people's lives worse. And that's what you're doing, and that's your goal, and that's your end game. And you're okay with that. And I can't imagine being that kind of a person.
Yeah. That I think sums things up beautifully. So, thanks for listening to Real Stories, Real Problems with your hosts, Rachel and Roxanne, or in this case, Amanda. We hope you enjoyed our deep dive into health insurance inequality and the documentary Sicko. Join us again next week for a glimpse into another financial problem and a documentary all about it. If you enjoyed our show today, please remember to like, subscribe, and leave us a review on your podcast app. Thanks for listening. See you again next week.